Today I'm going to demonstrate my extrajugular vein OSCE. So I have my pre-prepared 7 pieces of equipment with my pre-drawn up and drug-checked 4 mils of saline attached to the end of my IV cannula. I will first gain consent from my patient for this procedure. However, he's unconscious, so we won't be doing this. However, I will continue to talk throughout my procedure. We would then rotate his head to the side so we have better access to his jugular vein, and we would want to try and distend his jugular vein. So a couple of ways we can do this is to ask him to bear down. However, as he's unconscious, we will tamponade the supraclavicular space. When we have our vein properly distended and have our insertion site ready, I can palpitate the vein and clean the area. My insertion site will preferably be within the top half to third of the vein. This is to ensure that we don't infiltrate the pleural cavity or cause a pneumothorax. When my site is clean, I will traction the area, keeping on my tamponade, and get my cannula sharps out. I have my saline attached to the end of the cannula. This is to ensure that upon insertion we don't cause any air embolism. Inserting at 15 to 20 degrees. When I think I'm in the lumen of the vein, we can aspirate, check for flashback. When we have this, flatten and advance 2 to 3 mil the whole unit. Then we can advance just the cannula tip off the syringe. However, we don't yet want to remove the needle. And once we're fully advanced, I will tamponade, get my gauze and place this under the cannula tip. This is to catch any blood that may flow out when we remove the needle. So I will remove my needle straight into the sharps and attach my lure plug. Go. Then secure it with a piece of tape to prevent it ripping out during the rest of the procedure. We don't want to push this down too hard as we still want to have good access to insert further drugs or fluids. I will then flush the line, so I'll get my offsider to check my flush.
9% sodium chloride in 10 mils. Date is 2021-06.
Thank you. Now call this out loud again. So 0.9% sodium chloride in 10 mils and expires 2021-06. And get rid of the seal and any air in the flush. Attaching it to our lure. I would want to aspirate first to ensure that we're still in the vein, and then flush. When we're doing this, we want to look for any blebs or feel for any resistance that might indicate we're no longer in the vein and have infiltrated the surrounding tissue. When I'm happy that the line is patent, I will secure it with my tachyderm. When securing it with the tachyderm, we want to ensure that we can still see the insertion site, just so that we can keep an eye that things are okay throughout our transport. Remove the outside tape and further secure it. I would then record the date and time of this procedure, so 2/18 on the 7th of March, and then place this on top of our tachyderm.